Katie Viola. I am a breast health and genetics nurse navigator. Our high risk and cancer genetics program is a program that looks at your genetic susceptibility to cancer. So we focus on cancer. We do genetic testing, genetic counseling, and if you come back with a gene mutation that is worrisome, then we follow you throughout more elaborate screenings and following. If your survey comes back that you either meet that genetic testing criteria or you're at an increased risk of breast cancer, our nurse navigator calls the patient, talks to them, and talks them through what it means to be high risk or meet the genetic criteria, and explains to them the process of getting an appointment. They will help set up that appointment. They are called. They do not have to call our office. They then come in and see our nurse practitioner, Mackenzie Smart. She does genetic counseling with them and discusses the ins and outs of that. And if they want to pursue genetic testing, they can do it in our office. If they do not, and they are at an increased risk for breast cancer, we can talk about increased screenings and things that Mackenzie can manage for them.
My name is Mackenzie Smart, and I'm the nurse practitioner of the High Risk and Cancer Genetics program here at Erlacher. Cancer risk is complex and it's very individualized. So the best way to really know if you are at an increased risk would be if you have a personal history of cancer or a family history of cancer, to discuss that with your doctor and see if a referral would be needed. You could also go ahead and just call and schedule an appointment with us. We're happy to discuss that with you over the phone and then to get you scheduled. And then our newest addition to the program would be you can go ahead and take a risk assessment yourself via the link in this website. The first appointment can take a while. We do a very in-depth gathering of your personal history, and we review that. And then we take a comprehensive family history. We use all of that information to generate a pedigree. With that pedigree, we determine whether or not if you qualify for genetic testing. And then if you do, we talk about the risk and benefit of genetic testing, what that can identify for you. And then if we did find something, what we would do with that information. Not everybody chooses to proceed with testing. Not everybody qualifies for testing, but we would make that decision together. And then the follow-up appointments are actually where we get more of the information. Follow-up appointments consist of results review if you did proceed with testing. They also are where I manage your orders and results for your high-risk management. So pre-test counseling includes the initial visit where we gather all of your personal and family history. And then we do results discussions. We can facilitate genetic counseling if that is something that is needed. And then I also do long-term follow-up, individualized treatment plans, depending upon genetic test results, depending upon your personalized risk of cancer. That's different for everyone. For some people, we can't prevent all types of cancer, and so we have to utilize early detection measures, and sometimes that's imaging, sometimes that's procedures, but I help manage all of that because it's a lot for some people, and I don't want anything to get missed, and so we make it very concise and very clear for patients to follow so that they understand exactly what their plan is going to be. And then we also do a great job of communicating that with your primary doctor, but also all of the other specialists that will be a part of your care team.